You are watching the DocTalk show.
At what time of the pregnancy would you say the baby has a chance to survive if it comes to that point of having to terminate the pregnancy because of the preeclampsia? Dr. Jack, at what time in the pregnancy is it safe for one to say the baby might have a chance to live?
Well, firstly, it depends where you are. Where you've got the best neonatal care unit, so the best equipment for keeping very small babies alive, it might be when they're 26, 27 weeks.
28.
Exactly. And when you're in a setting like Malago, where you have at least some neonatal intensive care unit, it might not be quite that young, but again, at 30, 31 weeks, your baby might have a good chance of surviving. But if you're in a rural area which doesn't have any services for very small babies, actually the baby might not be able to survive until later on in the pregnancy, so 34, 35 weeks. So there's no exact time, it depends.
There's no exact time.
It depends where you are.
If the mother starts on the blood pressure medicines, is there a chance that the pregnancy can be extended and the baby survives?
Yes, so that's really the point of care. Trying to extend that pregnancy for as long as possible, because the longer that the baby has inside the mother's uterus, the more chance they've got for survival and for not having complications as well. Now, it gets very difficult when the mother has gone into the severe form of preeclampsia, because continuing the pregnancy may have a risk to the mother, the risks that we've talked about. But then terminating the pregnancy early may have risks for the babies. And so the doctor looking after you might have to balance those two risks together. And that's very, very difficult. And it's different for every mother because their baby might have already grown in a different way. So they might do a few things which can help. They can give a medicine called steroids, which can help mature the baby. And then they might deliver 24 hours a day later. But the balance is very tricky. You may go into hospital and the doctors try and control your condition, and during that process the baby does end up dying. You might think that then the doctor has failed you because your baby's died, but actually they were doing everything to stabilize your condition, and this is one of the consequences as well. Or the doctor may or the doctor may decide that you need an operation urgently to deliver your baby, and then your baby dies because of prematurity, and that's because the doctor was trying to save your life as well. So these are really, really difficult decisions, and that's why
very hard medical choices.
Absolutely, and that's why preventing it getting to that stage is the absolute key.
And none of the medications cures the condition. It is key that you know, they are not there to treat, and the condition is progressive. It will keep going on. These are just to help us prevent the complications that might come and just give us time to have.
There are two potential methods you could prevent preeclampsia happening in your pregnancy. Perhaps if you're overweight or you've got high blood pressure, you can have some lifestyle modifications. You make your diet better, you take some more exercise, and you take less salt. You may reduce your risk of developing preeclampsia. And then the other question, are there any medications which can prevent you having preeclampsia in the first place? We've talked about medications which prevent you deteriorating if you already have preeclampsia, but are there any medications which prevent it happening in the first case? The only studies have been done on a medication which is called aspirin, which your doctor might offer you if you've got risk factors for developing preeclampsia. But really, you have to give aspirin to quite a lot of women to prevent one case of preeclampsia. The studies haven't been done here in Uganda, but you could say you have to give aspirin to about 70 women to prevent one. So while you may be given aspirin, I think that might be a good idea, so talk to your doctor about that. However, when you're taking the aspirin, that doesn't mean you can't develop preeclampsia, so you still need to be aware of the symptoms and have your blood pressure taken in the antenatal clinic, because you're still at risk of preeclampsia.
Okay. So we know in our settings here, preeclampsia, much as it's a big condition, the community engagement may not be as strong. How has the UK managed to engage the communities in fighting preeclampsia, something that the Ugandan women can learn from?
Well, my key message is this, that preeclampsia can be absolutely tragic for women and babies, and identifying and managing it is the most important thing. So you must go to antenatal clinic and they must check your blood pressure. Now, although us as doctors and healthcare professionals might try as best we can to do all these things in the antenatal clinic, sometimes it doesn't work because there's lots of people and the equipment might not be working. So sometimes patients have to advocate for themselves. So my message to you would be, if you go to antenatal clinic and your blood pressure is not checked, then you're probably not receiving the care that you have the right to. So you can either speak up if you feel you can, or go and seek care from someone else. But don't just accept that they haven't done your blood pressure. Okay. I think it's very, very important that we hear from women and from patients about their condition. It's important for any health structure that patients are empowered, okay, to talk about their condition and have someone to advocate on their behalf. And if they haven't got the service that they have the right to, that they have a platform to feed that back, because that's how we get better as doctors and hospitals and healthcare workers.
Through
it's not just
from patients themselves.
Absolutely. So it's not just from the top, but also from the bottom. So we would like to see the creation of a patient group for preeclampsia, so that women have a voice and a platform.
Okay. So thank you very much, Dr. Jack, for that insight. I'm sure Dr. Mugisha will spearhead this in our setting. Yes, engaging the community in fighting preeclampsia is another important aspect to combat this very common disease. So remember, you've watched the DocTalk show, and we have discussed preeclampsia. The key points are this is a very deadly disease characterized by very high blood pressure. In pregnancy, it can result in the loss of the mother's life as well as the child's life. What is most important is, if you are a pregnant mother and you are a pregnant mother, it is always important you must go to antenatal and get your blood pressure checked, because this is the most certain way you can diagnose preeclampsia, and it's the only way the doctors will be able to properly manage this condition. And if indeed you have been diagnosed with preeclampsia, your doctors will give you the best possible care to safely deliver your baby and to remain in good health. Thank you for watching the DocTalk show. Send in your questions and comments to our social media platforms on Facebook and Twitter. Once again, we thank our guest doctors for the show, Dr. Jack and Dr. Mugisha. Thank you very much for discussing this very big topic called preeclampsia that seems to be disturbing lots of our Ugandan women. So we'll catch you next time on the DocTalk show. Have a great evening.
You are watching the DocTalk show.
Sugar is bad because sugar will help you gain weight. However, most people will substitute sugar with honey. Dr. Kasenene, is it true that if I use honey, I will not gain weight?
So what is true is that honey is a much better alternative to sugar. But what is equally true is that honey has more calories than sugar. And so when you're trying to lose weight, it's important to know that if you use so much honey, it could actually sabotage your weight process or your weight loss. However, honey in moderation can be acceptable. But we must focus on natural and unrefined honey. Some honey that we buy, for example, in the supermarket is refined and is actually what we call liquid sugar. If you look at this type of honey, it's just refined honey, and this type of honey may actually be worse for you than sugar. So anytime you want to use honey, aim to use natural, pure, unrefined honey, almost like what you have in your hands.
Okay.
And try and use it in moderation. But getting away from some honey will be good for you if you really want to have enhanced results. So this is really what some natural honey will look like. Thick, rich, and unrefined.
So natural honey is better than refined honey, but you must remember to eat honey in moderation if you want to keep your weight in check or to lose weight. Too much honey will make you gain weight. Less honey is good for your health and you will keep your weight down.